People underestimate the importance of what a kidney really does.
The kidney is an organ in the body that serves to eliminate wastes from the body that are due to regular metabolism.
And it does a whole lot. It's underestimated, and it's it's kind of like the unsung hero of the body. And in reality, the National Kidney Foundation provides an enormous amount of information.
I believe the statistic is that by 2012, the rate of kidney disease is going to double. So we have a big problem out there.
One of them was to define what chronic kidney disease is, and there's 5 stages, and stage 5 is renal replacement, where you require dialysis. Well, there are probably 20+ million people in the United States that are in stages 1 to 4, and they don't know that they have it, and that's what the KEEP screening is. It stands for Kidney Early Evaluation Program, and it screens people, the first-degree relatives of people with diabetes, kidney disease, or people that have either of those things or hypertension, for free. And at the end of the screening, they let those people see a nephrologist.
Actually, I just got back from their transplant camp.
Oh, camps. Oh, definitely. I love camp.
They get to intermingle with these people, go to camp with them, and because there's some medical assistance there, they actually dialyze children up at camp.
It's like the most awesome experience. You get to go on a ropes course and have a dance and hang out with people that have the same situation as you do.
And it's allowed these kids to go to camp and have a camp experience with children that are not do not have chronic diseases and feel normal for probably what is the first time in many, many years.
And at the transplant games, the last place finisher gets the biggest applause.
Absolutely.
And so it's truly a celebration of life, of a second chance.
Well, I don't know that I can list every program that the foundation is funding currently, but I think the research pieces are exceptionally good. You know, from my years as Commissioner of Public Health, the hardest dollar to develop and spend is prevention and education dollars. People spend for treatment, and yet if you could prevent any possible disease, you wouldn't spend dollars for treatment.
But we need somebody that's sitting there at the bench doing the research, and the Kidney Foundation support of research allows us to bring in these young individuals to help us with the research, participate in the research, and in addition, and most important, they are our future generation of physicians that will be taking care of these patients.
You know, there are a lot of things to like about working with the National Kidney Foundation. You know, first, it's always good to be involved in something within the community to help other people. Second, I think we have a number of really good programs that are trying to address at the earliest stages, you know, whether people are headed toward a medical condition that involves kidney disease. And quite frankly, there's a lot of things that can be done to forestall that or prevent it altogether.
I believe that with everything going on in today's society, and also the rise of diabetes that we're seeing, the National Kidney Foundation is going to have their work cut out for them, and they need help. They need a lot of help.
You know, I like the people in the National Kidney Foundation. I like the programs that we have that serve the community, and I'm very optimistic about the National Kidney Foundation because it's a solvable issue. I mean, I always think it's a positive to be involved with an organization that has an ultimate goal that's, you know, that's winnable.